Hello, and welcome to our online training on managing conflict. My name is Wendy Nakatsukasa Ono, and I'm Program Director for CARDIA. On behalf of the California Primary Care Association and CARDIA, my colleague Kyle Matsumoto and I are pleased that you have selected this module to support your professional development. CARDIA is a nonprofit, mission-driven organization with a principled team of committed and passionate staff. We've dedicated our careers to helping health and human service providers offer their best to the patients they serve. You may be aware that CPCA is offering this training as part of its Patient-Centered Health Home Recognition Program. This initiative is designed to support member clinics' efforts to move toward and achieve National Committee for Quality Assurance recognition. In this session, we're going to identify 8 causes of conflict, highlight 5 methods of dealing with conflict, and outline steps in conflict resolution. Let's start by defining conflict. As defined by Dr. Ralph Kilman, conflict is a situation in which the concerns of 2 people appear to be incompatible. In 2000 and 2002, Drs. Brett Hart and Art Bell collectively described 8 causes of conflict. The 8 causes are conflicting resources, styles, perceptions, goals, pressures, and roles, as well as different personal values and unpredictable policies. Let's talk about each of these causes of conflict in greater detail. First, conflicts can occur when individuals compete for limited resources, such as power and recognition in an organization or within a team, control or share of the budget, staffing, whether level of staff or access to certain individuals on the team, and even office space, private office versus cubicle, size of office, and proximity to the CEO, medical director, or other senior leader. Second, conflicts can occur because each member of a team is an individual with her or his own personality. For those of you who have used personality inventories, such as the Myers-Briggs Type Indicator, you know that some people are extroverts and others are introverts, and some are thinking while others are feeling in terms of how they make decisions. In addition, individuals can have different needs in terms of work environment. Some people prefer environments that are quiet, with less activity and interaction with other team members, while others prefer environments in which there's a lot of activity and interaction. Third, conflicts can occur because individuals perceive communication and feedback, events or incidents, and decisions in very different ways. For example, if a CEO sends a communication about a new patient satisfaction survey, one team member may see the survey as a sign that the CEO is unhappy with the team's performance, while another team member may see the survey within the broader context of quality improvement. Another example is an external hire. One team member may perceive the external hire as a sign that leadership does not recognize and value the contributions of current team members, while another individual may perceive the external hire as an infusion of new blood. Finally, decisions such as transition to patient-centered health homes can also be seen in different ways. For example, one team member may view PCHH as the issue of the moment, while another team member may view the transition to PCHH as a strategic response to the changing healthcare environment. Fourth, conflicts can occur when individuals have different goals, whether aims, scopes of work, or assignments and instructions. For example, a provider's aim may be to provide high-quality, patient-centered care, while a billing coordinator's primary responsibility may be to ensure that the organization receives payment for services rendered. While both aims are clearly important, providers and billing coordinators may be at odds when billing coordinators need to request time with providers to ensure that procedures are coded properly to minimize rejection. Fifth, conflicts can occur when there are pressures such as competing priorities, and reliance on others to complete certain aspects of a project. For example, a medical assistant may be under pressure because a coworker called in sick and she needs to cover patients for 2 providers. Another example is that a CEO may be under pressure to complete an important report for a funder, but need data from the chief financial officer who's in the middle of the audit to complete the report. Sixth, conflicts can occur because a team member has new or different responsibilities, or because 2 team members are given the same assignments or instructions. For example, providers may have difficulty adjusting to a team member who is promoted to medical director, or team members may have difficulty adjusting to a nurse's new care coordination responsibilities. Another example is that 2 nurses may be asked to work on a quality improvement project that was typically completed by 1 nurse, resulting in conflicts over who will take the lead on the project. In addition to these 6 causes, conflicts can be caused by different personal values, whether ethical or more commonly cultural or workplace values. For example, younger team members may be more comfortable with electronic communication, while older team members may be more comfortable with face-to-face interaction. Recently, I was talking with the executive director of a local organization, and she commented that she is taken aback when younger team members send notice of resignation via email. Another example is that team members may be expected to dress in a certain way if and when they interact with funders or the public. Finally, conflicts can occur when policies are unpredictable, when policies are absent or non-existent, or when policies constantly change or are inconsistently applied. But while we may think of conflict as destructive or harmful, conflict is not always negative. In fact, conflict can be healthy and productive. So let's look at the ways in which conflict can be positive.
Conflict can be healthy and productive when there are differences in knowledge, opinion, or perspective, and approach that result in change for the better, generate new ideas and facilitate needed change, foster new ways to solve problems, lead to needed behavior change, shed light on underlying issues or problems and lead to resolution, foster empathy and understanding, and enhance group and team development, and identify issues of importance to others. And as we know, conflict can also be negative. Conflict can be unhealthy when there are differences in knowledge, opinion, or perspective, and approach that result in lack of respect, lead to silence or withdrawal, foster cliques, promote gossip and rumors, and lead to name-calling and/or personal attacks. Ultimately, managing conflict is about acknowledging and appreciating differences. So let's talk about methods of dealing with conflict. As outlined on CPP's website, Drs. Kenneth Thomas and Ralph Kilman developed the Thomas-Kilman Conflict Mode Instrument, or TKI, in the early 70s as a research tool. The TKI is now considered one of the best assessments for understanding how different methods of dealing with conflict affect interpersonal and group dynamics. CPP is the exclusive publisher of TKI, which is now available for a fee in both paper pencil and online self-scoring versions and takes about 15 minutes to complete. As outlined on Kilman Diagnostics' website, the TKI is designed to measure a person's behavior in conflict situations. Dr. Kilman and colleagues describe an individual's behavior along 2 dimensions: assertiveness, the extent to which an individual attempts to satisfy her or his own concerns, and cooperativeness, the extent to which an individual attempts to satisfy the other person's concerns. These 2 dimensions define 5 different methods of dealing with conflict: competing, collaborating, compromising, avoiding, and accommodating. As Dr. Kilman and colleagues note, no one has a single method of dealing with conflict, and each of us is capable of using all 5 methods. However, certain individuals use some methods more or less than others. In this figure, you see the relationship between assertiveness and cooperativeness in these 5 methods. Both competing and collaborating are high on assertiveness. Those who use competing and collaborating as methods tend to get their needs met. But while competing is low on cooperativeness, collaborating is high. Those who use competing as a method tend to meet their needs at the expense of others, while those who use collaborating as a method are concerned about meeting both their needs and the needs of others. Compromising is moderate in both assertiveness and cooperativeness, so everyone may feel unfulfilled because no one's needs are truly met. In contrast to competing and collaborating, avoiding and accommodating are low on assertiveness. Those who use avoiding and accommodating as methods do not tend to get their needs met. But while avoiding is low on cooperativeness, accommodating is high. Those who use avoiding as a method are not concerned about meeting their needs or the needs of others, while those who use accommodating as a method tend to meet others' needs but not their own. Let's listen to Dr. Kenneth Thomas talk about conflict and the relationship between assertiveness and cooperativeness and the 5 methods of dealing with conflict.
I'm Ken Thomas. I guess I was a part of that generation that had to learn assertiveness training because it wasn't practiced in my family. And that was one of the things that got me interested, I think, in this framework. I think it was the 60s, because of social conflict and peace activism and so on. People were interested in talking about conflict, but they did it in simplified ways. They talked about cooperation versus competition. And for a lot of people, that was it. It was either or. It was one or the other, or there was some dimension, and you could be, mostly cooperative or mostly competitive and so on. So when this framework came along that said, look, you can be assertive and you can be cooperative, and those are independent things. They're not opposite ends of a single spectrum. That really opened up people's minds. If you say you have a conflict problem, what people expect to find is a bunch of people yelling at each other. But it can show up in a lot of different ways. You can go into an organization where nobody says anything negative to anybody else, but you can see that they're walking on eggshells. So then right away, they're not addressing the things that they care about. Other organizations, you'll find a lot of anger and hurt feelings, a lot of relationship kind of damage. Maybe some people not even talking to each other anymore. Companies that had been high performers, high flyers, lost ground because apparently of the way conflict wasn't dealt with. Conflict is just as much an opportunity as it is a danger. So I think of it as a challenge. It's something that we want to manage carefully. But what you're trying to do is you're trying to manage the conflict so you harvest the information that's in it, find out the best decisions you can make, and then take action. Well, if you walked into a company that was managing conflict well, you would hear spirited discussion. People would feed in whatever information, views, experience that related to the problem. They might say things like, well, that's interesting what you just said, but that's only part of the problem, and here's another part of the problem. And people would listen, and they might debate some of the facts. But you'd find people not only stating what they believe to be true and important, but also listening to what other people say, and then looking for ways of incorporating them together into a superior decision. And that would be pretty healthy. There's potentially no end to the benefits from constructive conflict management.
I hope you enjoyed the video. Now let's look more closely at each of the 5 methods of dealing with conflict.
We can think about competing as it's my way or the highway. Competing is characterized by use of power and influence at the expense of others, and tendency to argue and debate, assertion of opinions and feelings, and commitment to standing one's ground, whether out of principle or simply trying to win. If you answer yes to these questions, you may tend to overuse competing as a method of dealing with conflict.
Do people seem to walk on eggshells around you? Do people seem reluctant to ask questions? Do people seem reluctant to share ideas and suggestions or opinions and feelings? If so, it may be because of your tendency to pull rank and or constantly argue and debate.
If you answer yes to these questions, you may tend to underuse competing as a method of dealing with conflict.
Do you feel powerless in certain situations because you don't believe you have influence or because you're uncomfortable using power and influence? Do you have difficulty sharing ideas and suggestions or opinions and feelings because you want to avoid power struggles and hurt feelings?
In contrast to the it's my way or the highway approach of competing, we can think about collaborating as we can both win. Collaborating is characterized by the ability to listen, presentation of perspectives in a non-threatening way, analysis of underlying issues and input, and ability to be patient with process. If you answer yes to these questions, you may tend to overuse collaborating as a method of dealing with conflict.
Do you devote time and energy to in-depth discussions of all or most issues? Do you struggle to encourage others to be collaborative? If so, it may be because collaborating may make it easy for others to disregard your offer to find integrative solutions.
If you answer yes to these questions, you may tend to underuse collaborating as a method of dealing with conflict.
Do you have difficulty viewing differences as opportunities to learn and problem solve? If so, it may be because, in part, you're pessimistic about the possibilities of collaboration and or get impatient with the process. Do others seem reluctant to buy into decisions? If so, it may be because they don't see their ideas and suggestions incorporated.
One way to think about compromising is, let's make a deal. Compromising is characterized by the ability to negotiate and willingness to make concessions and find middle ground. It is also characterized by respect for others. If you answer yes to these questions, you may tend to overuse compromising as a method of dealing with conflict.
Do you tend to lose sight of mission, vision, values, and or strategic objectives because you are so focused on making concessions and finding middle ground? Do you often find yourself bargaining and trading?
If you answer yes to these questions, you may tend to underuse compromising as a method of dealing with conflict.
Do you feel embarrassed about negotiating? Do you have difficulty making concessions because you believe it's important to stand your ground?
We can think about avoiding as, I'll think about it tomorrow. Avoiding is characterized by a tendency to withdraw from conflict and a willingness to leave issues or situations unresolved. If you answer yes to these questions, you may tend to overuse avoiding as a method of dealing with conflict.
Do people seem frustrated when asking for your ideas and suggestions or opinions and feelings? Are decisions made without you? If so, it may be because you tend to ignore requests and or procrastinate.
If you answer yes to these questions, you may tend to underuse avoiding as a method of dealing with conflict.
Do you find yourself stepping on toes or hurting people's feelings because you don't know when to back off or how to frame issues in non-threatening ways? Do you feel overwhelmed by a number of issues because you have difficulty setting priorities?
And finally, we can think about accommodating as, I'd be happy to. Accommodating is characterized by willingness to take direction and willingness to set aside one's desires and yield to others. If you answer yes to these questions, you may tend to overuse accommodating as a method of dealing with conflict.
Do you feel like others ignore or minimize your ideas and suggestions or opinions and feelings? If so, it may be because you tend to defer to them. Do others seem to disregard policies and procedures because you readily make exceptions?
If you answer yes to these questions, you may tend to underuse accommodating as a method of dealing with conflict.
Do you have difficulty building goodwill in relationships? If so, it may be because you struggle with how to make concessions on even minor issues. Do others seem to regard you as unreasonable? Do you have difficulty admitting when you're wrong and knowing when to give up? Do you recognize that there are some exceptions to policies and procedures?
At this time, please pause the recording and reflect on these two questions. If you're viewing this module with a partner, please share your responses to these questions. Which method or methods of dealing with conflict do you use most often? And which methods do you use less often? So let's look at some examples of these 5 methods of dealing with conflict. First, let's look at an example of conflict between 2 colleagues. 2 medical assistants are organizing a supply room. An individual who uses competing as a method might say,
I organized the old supply room. I know that it'll work best to put these items here and those items over there.
An individual who uses collaborating as a method might say,
What are your thoughts about how to organize this new supply room?
An individual who uses compromising as a method might say,
Okay, we can put these items here and those items over there, but let's organize the shelves in this way.
In response to a suggestion from her or his colleague, the medical assistant who uses avoiding as a method might simply say,
Sure.
And finally, an individual who uses accommodating as a method might say,
I thought we might put these items here and those items over there, but I'm sure you know best. You've been working here longer than I have.
Now let's look at an example of a conflict between a supervisor and team member. The clinic schedule is changing from Monday through Friday from 9 to 5 to Monday through Saturday from 8 to 4. Your supervisor asks you to shift your current schedule of Monday through Friday from 9 to 5 to Tuesday through Saturday from 8 to 4. An individual who uses competing as a method might say,
I can't do that. I don't want to work on Saturdays.
An individual who uses collaborating as a method might say,
I understand that coverage is an issue, and I'm prepared to do my part. What options might there be in addition to Tuesday through Saturday from 8 to 4?
An individual who uses compromising as a method might say,
Would you be willing to consider alternating Saturdays? Perhaps I could work Monday through Friday from 8 to 4 one week, and then Tuesday through Saturday from 8 to 4 the next week.
In response to a suggestion from her or his supervisor, the team member who uses avoiding as a method might simply say,
That's fine.
And finally, an individual who uses accommodating as a method might say,
I can do whatever you need. I'm sure that other people have more scheduling challenges than I do.
So which method is best for dealing with conflict? All methods can be useful, depending on the issue or situation. In this figure, you see the interaction between goals and relationships in these 5 methods. Both competing and collaborating are high on goals. Those who use competing and collaborating as methods tend to be focused on outcomes. But while competing is low on relationships, collaborating is high. Those who use competing as a method tend to focus on outcomes at the expense of relationships, while those who use collaborating as a method are equally concerned about outcomes and relationships. Compromising is moderate in both goals and relationships, so everyone may feel unfulfilled because no one's outcomes are truly met. In contrast to competing and collaborating, avoiding and accommodating are low on goals. Those who use avoiding and accommodating do not tend to be focused on outcomes, but while avoiding is low on relationships, accommodating is high. Those who use avoiding as a method do not tend to focus on outcomes or relationships, while those who use accommodating tend to focus on relationships, but not outcomes. Competing may seem to be a negative method of dealing with conflict, yet competing can be appropriate when a crisis needs immediate attention and the stakes are high. It's also appropriate when goals are important and relationships are not. Those who use competing as a method can contribute to the team by being powerful advocates. They're often a force for moving issues and processes along. They're also able to face unpleasant facts and push for decisions that may be unpopular. In addition, those who use competing as a method often say what needs to be said, encouraging others to test their assumptions. And finally, they're often willing to take the lead when quick action is needed. Let's look at a situation in which competing might be an appropriate method.
A patient collapsed in room 3 and is unresponsive. I'll stay with the patient. You call 911. You wait for the paramedics.
Collaborating is appropriate when there's sufficient time to resolve the concerns of all parties, when learning and integrating perspectives, and when securing commitment. It's appropriate when both goals and relationships are important. Here's a situation in which collaborating might be an appropriate method.
With the movement to patient-centered health homes, we have an opportunity to develop a new model of providing care that includes care teams. What questions do you have? How can we best support you and your team?
In contrast to collaborating, compromising is appropriate when time is limited. It can be useful when instituting temporary solutions and creating backup plans, or resolving issues that are reasonably important. Therefore, it's appropriate when goals and relationships are moderately important. Because compromising seeks to find an expedient solution that somewhat satisfies all parties, it can be used as a first step along with one of the other 4 methods. Let's look at a situation in which compromising might be an appropriate method.
I understand that you have reservations about the changes in the schedule. Let's try these changes for 2 weeks and then discuss pros and cons.
Avoiding is appropriate when a cooling off period is necessary, and unlike competing, when faced with issues that are not very critical. It is also appropriate when goals and relationships are not very important, although it may take the form of diplomatically sidestepping an issue or postponing the issue until a better time. Like compromising, it can be used as a first step along with one of the other 4 methods. Here's a situation in which avoiding might be an appropriate method.
My sense is that this is not a good time for us to have this conversation. Let's talk about this issue tomorrow.
Finally, accommodating is appropriate when keeping the peace and creating goodwill. Therefore, it's appropriate when relationships are important and goals are not. Let's look at a situation in which accommodating might be an appropriate method.
I understand that you've been under a great deal of stress. Let's put these charts aside for now, and tomorrow we'll work on them together.
Now, let's discuss how you can create a conflict management action plan to effectively address an issue or situation that you're perhaps currently dealing with. In creating a conflict management plan, key questions include: what is the conflict? What is the cause of the conflict? What strategies can you use to move towards resolution? Whose support do you need to resolve the conflict? What is the impact of not resolving this conflict? And what will be a positive outcome of resolving the conflict? At this time, please pause the recording and reflect on an issue or situation that you're currently dealing with. If you're viewing this module with a partner, please share your responses to these key questions. Again, they include: what is the conflict? What is the cause of the conflict? What strategies can you use to move towards resolution? Whose support do you need to resolve the conflict? What's the impact of not resolving this conflict? And what will be the positive outcome of resolving the conflict? So now that we've discussed the causes of conflict, methods for dealing with conflict, and how to create a conflict management action plan, let's outline steps in conflict resolution. There are 3 primary steps in conflict resolution: planning, starting the conversation, and finding a solution. Let's start with planning. Planning the conversation is critical, yet we often overlook or skip this step. Key stages in planning include: describe the conflict, including any background and history. Identify the cause of the conflict, again, resources, styles, perceptions, goals, pressures, roles, different personal values, and/or unpredictable policies. Outline why the parties involved should resolve this conflict. Define your intention, what you want to happen, and identify what the other party's intentions and desires might be, what they might want to happen. Let's look at an example of how to plan the conversation. First, describe the conflict.
One of our physicians generally works within the structure of her new care team, but goes to trusted colleagues from her former team when she encounters challenges.
Second, identify the cause of the conflict.
The physician is struggling with the transition to patient-centered health home and the way in which care teams have been designed.
Third, outline why the parties involved should resolve the conflict.
We are moving to PCHH, and care teams are critical in transforming how we deliver care. We value the physician's contributions to the organization and care about her satisfaction.
Fourth, define your intention.
We are committed to supporting the physician in fully making the transition to PCHH and her new care team.
And finally, identify what the other party's intentions and desires might be.
The physician may want to go back to the way that she used to provide care and to her former care team. She may not intend to change her interaction with her former care team, or may even intend to leave if her desires are not met.
Now, let's move to starting the conversation. But before we talk about the specific stages of starting the conversation, let's look at motivational interviewing as a style that can be applied to managing conflict. In 1992, Drs. William Miller and Stephen Rolnick co-authored Motivational Interviewing, Preparing People to Change. As Dr. Rolnick highlights on his website, motivational interviewing is a directive, client-centered counseling style for eliciting behavior change by helping clients to explore and resolve ambivalence. Motivational interviewing is a style that has been used in a variety of settings and ways, and as we mentioned earlier, the basic approach to interactions in motivational interviewing can be applied to managing conflict. The basic approach is OARS: open-ended questions, affirmations, reflective listening, and summaries. Open-ended questions facilitate dialogue, require the other party to provide more than a simple yes or no response, and usually build from general to more specific as the conversation evolves. Open-ended questions often start with words like how or what. Examples of open-ended questions include:
What are your thoughts about our move to PCHH and the impact on your team? And tell me more about how your team is doing.
Affirmations acknowledge that the other party may have challenges, validate the other party's experience and feelings, and emphasize past strengths and successes. Examples of affirmations include:
I understand that moving to PCHH is a change, and it's great that you've consistently met this new quality indicator.
Reflective listening demonstrates that you are truly listening and helps you check for meaning and interpretation of what the other person is saying. Reflective listening may include repeating, rephrasing, or paraphrasing what the other party said, and reflecting the other party's feelings. Examples of reflective listening include,
"It sounds like the move to PCHH has been challenging for your team. What I hear you saying is that the schedule is manageable at the moment, but we should continue to monitor it."
Summaries allow you to reinforce what has been said, pull together important ideas and facts, and build a foundation for further discussion. An example of a summary is,
"It sounds like moving to PCHH has been a change. I'm glad you recognize how challenging it is for both current and former team members when you ask former team members for help. We agree on 3 next steps and to meet in 2 weeks to assess team dynamics."
As you move through a conversation, words that are helpful to use include, "I can understand," "help me understand," "I think," "I feel," "my sense is," "I would like to," and "here's what I'm willing to do or change." Words to avoid include, "You're wrong," "You always," and "You never." And I think it goes without saying, but you certainly want to avoid using profanity and references to the other person's culture, including age, gender, race, ethnicity, sexual orientation, religion, and ability. So let's return to the second step, starting the conversation. Starting the conversation is often where we stumble, but good planning certainly makes it easier. Key stages include, name the issue and highlight a specific example that illustrates the issue or situation you want to resolve. Describe your emotions about the issue or situation. Clarify what's at stake. Identify your contribution to the conflict. Indicate your wish to resolve the conflict, and invite the other party to respond. Let's look at an example of how to start the conversation. First, name the issue and highlight a specific example.
The transition to PCHH will help us provide even higher quality care to our patients, particularly those with multiple chronic conditions. You are doing a great job with your new care team, and in the last 2 weeks, I've also noticed that you go to trusted colleagues from your former team when you are pressed for time.
Second, describe your emotions and clarify what's at stake.
I can understand that it's difficult to change the way you used to provide care and your relationship with your former care team. At the same time, it's important to continue developing relationships with your new care team for the well-being of your patients, your current team, and yourself.
Third, identify your contribution to the conflict, indicate your wish to resolve the conflict, and invite the other party to respond.
I may not have provided sufficient support to help you make the transition to your new care team, and I'm committed to ensuring that you have that support. How can I best do that?
Finally, let's move to the last step, finding a solution. Key stages in finding a solution include, describe the conflict as a mutual problem, offer to negotiate differences, brainstorm and evaluate alternative solutions, decide on the best options, plan how to move forward with the solution or solutions, and plan how to follow up. Let's look at an example of how to find a solution. First, describe the conflict as a mutual problem and offer to negotiate differences.
We've had a lot of change over the last year, and I understand that change is difficult. At the same time, it's important for all of us to be on board with PCHH. Are there other concerns or questions that we haven't addressed? What have I missed?
Second, brainstorm and evaluate alternative solutions and decide on the best options.
Possible solutions include examining the level and composition of staff, better defining roles and responsibilities, allocating more time for team interaction and planning, and engaging a coach. What do you think of these options? Are there others you would add? Which are the best options?
Third, plan how to move forward with the solution or solutions and how to follow up.
Would you be willing to look at the current composition of staff and propose some new alternatives? I'll work on identifying some potential coaches. Shall we meet in a week or so?
Gandhi said, "What may appear as the truth to one person will often appear as untruth to another person, but that need not worry the seeker. Where there is honest effort, it will be realized that what appear to be different truths are like the countless and apparently different leaves of the same tree." As we acknowledged at the beginning of this session, conflict can be healthy and productive, and managing conflict is about acknowledging and appreciating differences, those countless and apparently different leaves of the same tree. The keys to managing conflict are recognizing the causes, finding the appropriate method or methods for dealing with conflict, creating a conflict resolution plan, and engaging in the 3 steps of conflict resolution: planning, starting the conversation, and finding a solution. Here are a few links to resources. This concludes our online training session on managing conflict. Again, this module is part of a series of online courses provided by the California Primary Care Association as a demonstration of its mission of strengthening its member clinics and networks through advocacy, education, and services in order to improve the health status of their communities. For information on other online training opportunities, please visit the websites for California Primary Care Association and CARDIA. Thank you for your participation.